Welcome to the Myeloma Matters podcast, hosted by the Multiple Myeloma Research Foundation and focusing on patients' experiences with and perspectives on multiple myeloma topics that matter to anyone affected by this blood cancer. In this episode, you'll learn how and why multiple myeloma affects the bones, as well as how patients can maintain their bone health. You'll also hear from two patients who experienced drastically different complications from bone disease and learn what they've done and continue to do to maintain the strength and health of their bones. Please note that every myeloma patient is unique. The information in this podcast is not intended to replace the services or advice of trained healthcare professionals. Please consult with your healthcare team or contact the MMRF Patient Navigation Center at 1-888-841-6673 if you have specific questions about your health. Many patients first learn that they have multiple myeloma after experiencing an issue with their bones, such as bone pain or a fracture. Multiple myeloma is a disease of the bone marrow, which is the soft tissue inside the bones where blood cells are made. The bone marrow helps regulate bone health by controlling a process known as bone remodeling. In healthy individuals, old bone is replaced with new bone in a constant cycle. In people with multiple myeloma, myeloma cells develop and accumulate, disrupting the balance between bone removal and bone growth, which can lead to bone loss. Up to 85% of people with multiple myeloma experience bone disease. In some people, myeloma may cause thinning and weakening of the bones to the point where holes are formed in the bone, which can lead to pain or fractures. These most commonly occur in the bones of the spine, pelvis, and rib cage. If bone weakening occurs in the spine, it can also lead to a condition known as spinal cord compression. This occurs when bones in the spine collapse and put pressure on the nerves in the spinal column, which can cause sudden and severe back pain, numbness in the legs, and muscle weakness. Spinal cord compression is a serious condition that requires emergency medical attention. Bone loss can also cause levels of calcium in the blood to increase. This is called hypercalcemia, and it can lead to complications like kidney stones, nausea, vomiting, constipation, fatigue, and dehydration. In very severe cases, it can lead to kidney failure or coma. For some people, it may be obvious that something is wrong with their bones, even if it isn't immediately recognized as an effect of multiple myeloma. This was the case for our first guest, Mike Mankiewicz, who was diagnosed with multiple myeloma in 2017.
I was diagnosed probably a little over 5 years ago. Prior to having been diagnosed, I was having back pains. And probably for maybe 8 to 12 months prior to being diagnosed. And the first thing I did was I went to a chiropractor, which was probably the worst thing I could have possibly done.
Mike left the chiropractor in more pain than he had when he went in. After another painful visit with a chiropractor, he went to a doctor who prescribed him anti-inflammatory medications for a suspected muscle tear. When the pain kept coming back, Mike knew it was time to see an orthopedic specialist. The orthopedist ordered an MRI, which revealed fractures and bone lesions in his spine.
Yeah, I'm sitting in my office at work, and I pull this report off the fax, and in the report, it basically provides a conclusion. That conclusion being it's either metastasized cancer or multiple myeloma. So we all know what I was pulling for. It was a rough day, to say the least.
For other patients, bone issues may be more subtle and can be dismissed as regular aches or pains that are related to normal activities until they lead to a medical emergency. This was the case for our second guest, Jamie Alamillo.
I do work outside. I had simply bent over to pick up something that was in a path of travel and move it off to the side. And as I came back up, I felt this feeling in my back. I'm like, okay, I must have pulled something. I was 43 at the time, and I figured, hey, it'll heal up in about a week.
The pain didn't get better, though. Jamie would rest and relax until his back felt better, only to be met with severe pain once he tried to return to regular activities. After a month of this cycle, Jamie had another episode of back pain that felt different. He says he told his wife he was going to stay home from work because he wasn't sure what was going to happen.
I took a shower, got back out of the shower, and then I immediately went paralyzed from the waist down. After that, it's kind of a blur, but I do remember going to the emergency room, and my doctor that was trying to figure out what was my diagnosis or what was going on, she was able to get us to the front of the line because, of course, it was packed and I had no movement.
2 days later, Jamie returned to the hospital for emergency surgery as a trauma patient.
I was considered trauma, and the myeloma had broke my back at T7 and L4. And then also I had lesions all along my spinal cord. Actually, I wasn't the first one to find out. My wife was the first one to find out that I had multiple myeloma.
Bone damage in multiple myeloma is serious, but the good news is that it is treatable. Treating the underlying myeloma is one way to help prevent further bone damage, as reducing the number of myeloma cells in the bone marrow can help restore the balance between bone growth and removal. In addition to providing regular myeloma treatment, a myeloma patient's healthcare team may also prescribe medication to help with bone issues. These medications work by blocking the activity of the cells in the bone marrow that are responsible for breaking down bone tissue, which can help lower bone pain, reduce the likelihood of fractures, and prevent bone disease from getting worse. 2 types of medicines are typically used to manage bone disease in multiple myeloma. Bisphosphonates, such as Zometa, which are given intravenously, and the monoclonal antibody Xgeva, which is similar to Zometa, but is given as an injection under the skin. Xgeva is typically considered an alternative treatment option for patients who are not able to take bisphosphonates, for example, patients who have kidney problems. The goal of treatment with either of these medications is to stop or slow the pace of bone loss. Neither is able to rebuild bones that have already been damaged. The healthcare team may provide other recommendations for maintaining bone health, such as eating calcium-rich foods, taking calcium or vitamin D supplements, and staying active. Indeed, staying active has been an important part of the recovery process for both Mike and Jamie, and they both understand just how hard it is to stay active at the start of the process. For Jamie, staying active meant starting from square one. With the fractures in his spine, Jamie was completely paralyzed from the waist down before he even knew he had multiple myeloma. It took a lot of physical therapy, medication, and perseverance to recover after his spinal surgery.
It took about a year of therapy. I had months and months of therapy, just teaching myself how to walk again and stand up and just able to function. But I was mainly in a wheelchair. Then I kind of graduated into the Canadian crutch, the Lofstrands double. And then after that, I went to double cane. And then it was a single cane. And then one day I just told my wife, let's go to the mall. And I'm ditching the canes.
Jamie also received several rounds of radiation therapy to help manage his bone pain. Low-dose radiation therapy is sometimes used to help manage specific bone lesions that cause recurring pain.
It was like a proton therapy, so it was a targeted radiation therapy. So it was more targeted, which now is the choice of treatment for a lot of cancer patients because they can target the actual lesion / or tumor. And then also the areas in the bones where, of course, our disease is in the bones. So it's able to target those specific areas. I think it truly helped me quite a bit.
Jamie still experiences bone pain and stiffness, mostly as a result of his spinal surgery, but he has learned to live with his bone disease. He knows what to expect from his pain and is quick to alert his healthcare team if anything changes. But staying active has made a world of difference. And Jamie now regularly participates in group bike rides with the MMRF across the country. Roughly 9 years after starting his recovery journey, Jamie recently completed a 550-mile ride from Santa Clarita, California, to Lake Tahoe. Both Jamie and Mike have come a long way since receiving their myeloma diagnoses and encourage others to stay active to help their recovery as well. Activity will look different for everyone.
For the myeloma patients that can't do much, there's stuff to do that you could sit down. There's a sitting down, there's a recumbent bike. There's dumbbells that you can do at home just to keep strong, because if the myeloma ever comes back, you're strong enough to handle it and you're in good shape, versus sitting at home in a corner and not doing much and woe is me. No, we can't do that.
Although there are many effective options for management of bone disease and multiple myeloma, the risk to bone health is constant and requires careful ongoing management. Episodes of disease recurrence can lead to new or worsening bone disease. When there are changes in bone pain, or if new fractures develop, it's important for patients to let their care team know about it. Long-term use of bisphosphonates, or Xgeva, is also potentially associated with a rare but serious condition known as osteonecrosis of the jaw, or ONJ. In ONJ, the bones in the mouth and jaw become eroded or die, leaving a painful open sore along the inside of the jawbone. Although it is recommended that bisphosphonates only be used for no more than 2 years, many patients stay on them for longer periods than intended. Both Mike and Jamie received Zometa for several years. Jamie never experienced any complications from his treatment, even after 6 years on Zometa. Mike, on the other hand, was not so lucky.
There's only one thing out there that had me more scared than multiple myeloma, and that was the specter of necrosis of the jaw.
Mike's doctors had explained to him that the risk for ONJ was very low, but internet searches still left him worried. He made sure to set up care with a dental specialist who had experience with ONJ and multiple myeloma, and was diligent about getting regular dental care. But after about 3 years in Zometa, Mike felt a sore on the inside of his mouth that wouldn't heal. He knew something was wrong.
But I tell you, I didn't really, I had everything I was reading about necrosis, I had a real hard time getting a handle on it. I kind of assumed that, it started and it would just continue to progress with time, and eventually you had to have your face replaced or something like that. I didn't realize that with a lot of people, they kind of would start and stop, and some people have very minor forms of it.
Mike's healthcare team confirmed that he had ONJ. They immediately stopped his Zometa treatment, but preferred to take a wait-and-watch approach before rushing to surgery. Fortunately, Mike was able to connect with an oral surgeon who suggested trying a different approach to managing his ONJ.
So he doesn't even throw he's in his jeans and a t-shirt, and, get in the chair, and it's totally cash. And he looks in there, he goes, okay, I have a lot of success when it's in that particular location. And he goes and he pulls out one of his probes or whatever. And he goes, sometimes I can just go in there and just kind of flick it off. I'm like, really?
Mike returned one more time to remove some remaining bone from his jaw that was diseased. In all, the amount of bone removed was so small, he says he doesn't even notice or feel a difference in his jaw. Like many people, Mike worried about ONJ more than his multiple myeloma. But ONJ is treatable when caught early and preventable with good oral hygiene and regular dental care. For both Mike and Jamie, experiencing bone disease led them to their multiple myeloma diagnosis. Both had to overcome pain and, in Jamie's case, recover from debilitating fractures that led to paralysis.
I still experience bone pain daily. It takes me a while to roll up and get out of bed and feel stiffness in my bones, and that's because of the spinal surgery that I had. Yeah, it's a long-going effect. I think it'll be with me for the rest of my life. Wish it wouldn't be, but I'm used to it now. So it's just like drinking coffee in the morning.
Like many patients with multiple myeloma, Mike and Jamie continue to be vigilant about their bone health. They encourage everyone with multiple myeloma to take the steps needed to keep their bones from weakening and emphasize the need to stay active in whatever form that may take. Whether that means walking or biking or even just getting up to cook a meal every day, They encourage everyone with multiple myeloma and their caregivers to keep moving as much as they can. Now let's hear more from Mike and Jamie, who are joined by Mary DeRome from the MMRF, who will share more about their challenges and the ways their bone disease has shaped their myeloma experience.
Jamie and Mike, thank you so much for joining me today to talk about bone health, which is a really important topic in multiple myeloma and one that comes up in questions from many patients on our webinars and patient summits. So let's talk a little bit more about your journeys. And we're going to start with talking about who on your care teams has been responsible for managing your bone health. Is that really your multiple myeloma specialist, or is it like the nurses or nurse practitioners, physician assistants that you work with? And where's the best place for patients to turn if they have concerns about their bone health? Jamie, I'm going to start with you on this one.
It's primarily with my oncologist, Dr. Black with UCLA. They're all UCLA physicians. And quarterly, he checks in with me in regards to just my blood work, and also, how just my overall body feels, because my cancer was in my spine, and my back had broke at T7 and L4. And that's, of course, the bones broke in those areas. And so they really monitor that, along with your own analysis of yourself on how you feel, and if something feels different. My oncologist is always on call. I do also think that my internal medicine doctor with UCLA also, she has a big responsibility too, because your oncologist is there just to take care of your cancer, keep it away, give you the cocktails that you need to keep your cancer away, whether you still have the cancer or you're still in remission of multiple myeloma. So I find myself going to both. To answer your question best, the internal medicine doctor does a lot more for me as far as prescriptions and what to do, whether if I would need some type of a therapy or a different type of medication.
Mike?
As far as my situation goes, I deal primarily with my oncologist. As far as bone health goes, I started out, when I was first examined, I had a number of lesions on my spine, some stress fractures, but nothing that was so bad that I needed any treatment specifically for my bone or my spine. It's been the oncologist, and when I developed problems with my jaw, I had a maxillofacial specialist get involved. But that was not an ongoing situation.
When you began to have problems, was it your oncologist that you first brought the problems to?
When I first had problems, I thought I had pulled a muscle in my back, and it became rather chronic, and I saw a few specialists. As a matter of fact, I went to a chiropractor first, which was not the best choice, given the fact that I was in far more pain leaving his office than I was going into it. I went and I saw a spinal specialist, for lack of a better term, and he sent me in for an MRI, and within 12 hours I got a phone call during which I was asked if I knew anybody at Sloan Kettering, which led me to believe that I might be dealing with something that was a little worse than I had anticipated. So they at that point, I was introduced to some folks from Sloan Kettering, an orthopedic specialist, who then introduced me to an oncologist who specialized in multiple myeloma.
Yeah, that makes perfect sense. So, Jamie, let's talk a little bit about when you started taking Zometa, because you had some really serious bone problems. And what did you expect to happen when you started taking Zometa? Did you expect it to help you as much as you think it did?
No, I really didn't. As a cancer patient, when you see these infusions going in, you're just like, okay, wow, here we go again. I was told by my Dr. Black, the UCLA physician, that this was just to strengthen up my whole skeletal system. That way, in case I did have some type of a fall, that it would be a rarity that something would break. all my trust into my physicians. I took that as a grain of salt, and I says, okay, well, then let's just keep doing this, because we did do it for an extended amount of time. I didn't think it would work because just how I felt, but feeling it now, I think it's gone a long way, especially everything that was wrong with me. My bones do feel better. Of course, I'm achy in the morning. During the days, just in my joints. I mean, I still feel bone pain. I truly believe that if it wasn't for the Zometa, my bone pain probably would have been more extreme than what it is right now.
Mike, did you have a similar experience with Zometa when you started taking it?
No, I had a totally different mindset than Jamie. Before I take anything, I research it, and probably like everybody else out there. When I read about Zometa, the one thing that stuck out to me was the side effect, the possibility of getting osteonecrosis of the jaw, which, reading about people who had experienced this side effect was rather unsettling. The thought of your jawbone starting to die and that death spreading throughout the jawbone and your jawbone basically decomposing in your face, man, that scared the hell out of me. And I never, ever stopped thinking about that. I was like, oh, well and good. I understand I need this. I've got issues with my spine. I had those they were either stress or compression fractures and lots of lesions. But there was not a day that passed that I wasn't concerned. And in the end, it turned out rightly so. I should have been concerned because maybe about 3 years down the road, I felt a little something inside my mouth, and it didn't go away over the course of a couple weeks, and my gut told me that this might be a problem. Saw the dentist at Sloan Kettering, and sure enough, it was the start of osteonecrosis. I was just a little bit upset. But, fortunately, there was a happy ending. I went to see this maxillofacial specialist who used to wrestle for Cornell, was part of the program that I was part of. That put me somewhat at ease. And when I went to see him, he took a look at it, and he said he had a lot of experience with it, and he had his own way of dealing with it that perhaps wasn't aligned with the way Sloan Kettering would have dealt with it. But he went in there, took a probe, and said that often he had luck in just flicking it off, and that's what he did. He just kind of reached in, stuck a pointy thing in my jaw, and flicked it, and said, "You'll probably be good." And I went back 2 weeks later. He cleaned up a little bit more, and I never looked back. It's fine.
I agree with Michael on that. Yeah, I did my research, but multiple myeloma is deadly enough. And I was willing to, even though reading some of the reviews as far as the side effects of Zometa, I knew everything that was there. But the one thing that as multiple myeloma patients, it's your body. If this is going to keep you alive, then why not do it? If it is I always called it lockjaw. Me and my wife always called it that because that name I cannot pronounce. We knew all about it. The oncologist knew all about it, and again, the multiple myeloma patients shouldn't be, again, yes, do the research on it, but you got a deadly disease, do anything and everything that will help you. And if you do have some type of a side effect, that's why there's doctors, there's professionals, there's specialists out there that'll take care of it, just like they took care of Michael. It kind of scares me that I read a lot of not only multiple myeloma patients, but other type of blood cancers that they stay away from something that could have helped them, but it's a chance we got to take. We got a deadly disease. We have to take that chance and just do what's best for us and the family, and just know the side effects and just keep moving forward.
So that's great. And so, Mike, you told us a bit about how your osteonecrosis of the jaw, or ONJ, was treated, and you told us how you detected it. Have you had any like recurrence of ONJ since that first time that you had it?
No, he treated it, and that was probably maybe about a year ago, and I've been fine ever since.
So, Jamie, when you were talking to your oncologist, what did you learn about the medications that prevent bone damage that you were receiving? Did you have any concerns about the long-term side effects? And were you as concerned about osteonecrosis of the jaw as Mike was from, getting your advice from Dr. Google, which is never a good place to read anything?
Yeah, well, that's the first thing my oncologist said when I was diagnosed. He told my wife, because my wife was Googling multiple myeloma, and all she kept seeing on there was survival rate of 2 to 3 years, and which is all old information. And my oncologist had told us, do not read that anymore, because multiple myeloma patients are living for 20 years. And of course, my wife, she works for UCLA, so she was into it. Just we were requesting literature on multiple myeloma, which was better. But it seems like the web is only going to give you the worst case scenario. So that was one thing that he told us: just stay away from looking at life longevity with multiple myeloma. Stay away from that. We're going to take care of you here. We have new drugs that are coming out. This is what's happening, especially when I'm in remission. I mean, I still take a Revlimid pill, a 10 milligram pill, which I hopefully one day will be off of it. But now, as far as initially when I was diagnosed, he did say that life expectancy was 3 to 7, and that my regime was going to be the RVD, which we all know, the Revlimid, Velcade, and dexamethasone, along with the Revlimid and the Zometa. Tying all those together, basically what he told us. And we didn't spend too much time on the web researching that. The jaw thing was in the back of our minds. We knew it was there. And my thought is, if it happens, it happens when we deal with it. I wasn't going to shy away from anything that was going to help me with my cancer. I just really only read just a little bit of information, just a few side effects. That was pretty much it. I mean, there's side effects with everything. I mean, videos kind of help me out. I kind of watch the progress in different multiple myeloma patients. That's all I really wanted to see. I wanted to see the success stories versus what could happen. But of course, it's always in the back of our minds and the family's minds. What if this happens, this type of side effect? And so it's always there. But again, my thought about this whole disease is just combat it with anything and everything that you have. I was 43 at the time. I'm 51 now, 52 now, but I was willing just to do anything, because I had a 1-year-old and a 3-year-old at home, and I wanted to live for them. So I told them, throw everything at me. I'm young, I'm strong. Let's do this.
So, how do you feel about your bones now? Do you feel like this treatment has really helped your bones remain strong? And are you still concerned about getting more fractures, or are you kind of past that part now?
I'm pretty confident, because I've had some falls accidentally, washing my car, and I have my Crocs on and I slip and fall down and I pop right back up, and I'm like, oh, I'm fine, feel sore. I felt that the treatment has again done me well. I hope I never fall. I'm an avid cyclist, and I raise money for for Multiple Myeloma Research Foundation. And the funny thing is, my oncologist is also a cyclist, and he tells me, Jamie, if you ever were to fall off your bike, you're not going to break your bones. You'll be totally fine. You jump right back up. So I'm like, oh, hearing that which I hope I've never fallen off my bike. I don't want to come to that point. I know that if I did have a fall, that I know at least the Zometa in some way, shape, or form is protecting my bones and bone health.
Great. That's awesome. Do you feel the same way, Mike?
I do. I feel great. Like Jamie, I go out and I raise money for MMRF. I've gone on a couple of these crazy treks. One was to Patagonia, and the other was Alaska. And my body held up fairly well. I made it. I finished it. I feel good, but I will say that every once in a while, if I feel a little twinge or any little pain in any of my bones, it makes me nervous. I'm questioning. I'm like, is it coming back? Because I'm very fortunate in the fact that I'm MRD negative at this point, so they can't locate it, they can't see it in my system. But we know it's still there, but at a very low level.
So you had some pretty serious bone issues. I mean, you broke your back basically, right, because of the myeloma that was there, and you actually got some radiation treatment for your myeloma. You're not still getting those, are you?
No, I'm done with. I only had 10 rounds of radiation, and then of course I had 37 rounds of chemotherapy, and then a successful stem cell transplant at UCLA, where I harvested my own stem cells, 5 million, and then they gave me back 2.5, which was that's what put me in remission, is that alone.
So that must have been very painful when you had those back issues. What steps did your healthcare team take to help you with your pain management when you were going through that? What did you have certain drugs that they gave you that worked, and then maybe some drugs that they gave you that didn't work? And you still have a pain today, but mostly I think it's like stiffness, right?
Stiffness, and yeah, I do have bone pain, and I think what I had mentioned to you before, like a trigger finger. Now I developed some type of a tennis elbow, and I think it's all contributed to MM. It's really hard to grip with my right hand, but we're treating that with the medication that kind of relaxes all the tendons within that area. When they knew I had broke my back at T7 and L4, first I had to heal, because on T7 I had some cadaver bones, and then I also had a cage installed in that area. And then my lower back was still damaged, but they felt that can fuse itself. The main therapy, just not drugs, is just the physical therapy and occupational therapy is what helped, because I had to learn how to walk again. I could not walk, and my mind knew I could walk, but my legs were not moving. They weren't firing. That's what really helped out, was just the therapy team, where they put me in a position to where, as far as like sitting was a big thing, especially with the back pain, in a wheelchair, sitting, adjusting, moving, laying down. It's positions that you lay down that helped me out a lot, as far as to relieve some of the pain and the pressure. A lot of pillows. So my physical therapy team did amazing. It was through Henry Mayo here in Santa Clarita, California. And the only really drugs that he had me taking, or medication, was oxycodone, which is not the best, but it's very addicting because it's a narcotic. I still take that today, but I take it to a minimum. Only when I come home and my bones are sore, my back is sore, so I'll just take one pill and be okay. It's oxycodone is just a blanket to hide the pain. It's something that the oxy, you don't want to take that if you're experiencing bad pain, because it'll make you good, and then you do more damage. It's just to get me through the night, where I just need that rest, and then everything feels the same. So to answer your question, it was my therapy team. It wasn't any type of medication. It was my therapy team putting me in the right positions at night, during the day, when I'm sitting, when I'm walking, just making the right movements, just to help with the pain.
That's great that you had access to a whole team for physical therapy, and they really helped you so much. That's a great story. So let's talk a little bit now about what you guys are doing to keep your bones healthy. Are you doing anything different in your diet?
Sorry to say, but I'm not really doing anything. I started out taking Zometa, and then I ran into some problems with that, so that was pulled. And now, other than some exercise and some light lifting, I'm not doing anything. And if there were a problem, my doctor tells me that it would show up in my blood tests. They'd see elevated levels of calcium, and that's not been the case. So, all is well. Knock on wood.
Jamie, how are you doing with your bones?
Same as Mike. I was on Zometa for an extended amount of time. I believe for about 4 years. I feel that that has helped me out tremendously. What I do about it on a personal aspect is I do a lot of stretching, because my back is stiff, as you can imagine, by having your back broken in an upper and lower location. Stretching is good. Exercise is probably one of the best things that I think any multiple myeloma patient could do. It just to keep yourself on a good little exercise regime. That way, if cancer ever does come back, at least you're strong enough. But every morning when I get up, I'm stiff. My back is stiff. My bones are achy. It takes me a few steps to walk normally. So stretching is huge. Now, as far as medically, what my oncologist or internal medicine doctor has done for me, it seems like the gabapentin that I take really helps out a lot. I take three gabapentin at night because it makes you extremely drowsy. So that does help. It kind of relaxes my body, relax the bones where I'm not tossing and turning. So it kind of keeps me in one position. That has helped tremendously as well. And I believe Zometa is probably the best thing that I could have ever received, because my bone health was not in good shape. I was prone to any type of fractures if I didn't receive that Zometa. And I know some people just can't combat Zometa, with the side effects. But I was lucky enough that the Zometa I had literally no side effects. There isn't a study passed, I think, after a year of taking Zometa, but the UCLA doctors felt that was the best thing that I could do, because I had lesions all over my body, and they wanted to make absolutely sure that I did not have any type of little small stress fractures or a major break. Yeah, that's what helped me out. And as far as diets, hey, I'm a cancer survivor. I'm gonna eat whatever I want to eat. I'm alive right now. I'm not changing my diet because I'm gonna live. I'm not gonna sit there and have a salad while everybody's having a double cheeseburger. I'm gonna have a double cheeseburger with you. And that's, everybody's different. But I'm alive. I'm well. Yeah, I'm just gonna eat whatever I want to eat.
Oh, good for you. I like to hear that. So, Mike, it sounds like you're really very active and going on all these treks and hikes for multiple myeloma. And I know that these weight-bearing exercises are really great for your bones, no matter who you are, right? And that really keeps your bones strong by doing that. But what would you tell, if we talk to other patients who are maybe older patients or caregivers of older patients whose ability to be active may be a little bit more limited? Do they still have some exercises or activities they can do that would help their bone strength?
Oh, absolutely. I mean, walking is an activity that helps keep us healthy. Any kind of physical activity can benefit your bone strength. If they're old and limited in what they can do, they push themselves to walk. Recumbent bikes. There are very few people who can't deal with either of those two activities.
So I think I have about one more question to ask you guys, and I'm going to ask this to both of you. Mike, I guess you can start, but when you were first diagnosed with multiple myeloma, do you feel like you learned from your care team about the issues about bone health and what the treatment options were, and they gave you the information that you needed, or was there anything that you felt like you didn't learn until it was much later, that you wished you had known it when you were first diagnosed?
No, I had an excellent care team at Sloan Kettering. I mean, they laid it all out for me. They were fantastic. I mean, they explained to me what they saw, what was wrong with my bones, what damage had been done, and laid out a plan as to how they were going to go about treating it. And along with that, were kind enough to provide details related to the risks that came with that treatment.
Now, Jamie, you had a sort of a different experience where your initial diagnosis really came with these broken bones. So I imagine that you were aware of the issues with your bones like right away, and that you received all the information that you needed up front.
I was considered trauma, so the information that was given to my poor wife. She was by herself, and family was en route to get to her with 2 little kids. So she received all the information, and immediately, being a well-educated woman, she immediately got online and started doing research, which, every time I saw her, she'd come in and be crying, and I'm like, what's the matter? She's like, no, nothing. We need to get through this. And then later on, of course, she told me everything that she was reading, and she expressed that to my doctor, Dr. Black and Dr. Schiller, they're both specialists, about that. And that's when they said, stop reading it. This is what's going to happen. And then they told me about the cocktail RVD, what was going to happen, and they told me the side effects of it. If there's any side effects, then we'll try something different, and we'll find the cocktails that suits you, for what has happened to you. And they're really responsive. I mean, when I had started to get my radiation, I just felt nauseated and just not good. And, it's a phone call away. medicine was prescribed and helped me get rid of that. The bone pain, give me prescriptions to help combat the bone pain as I was healing and going through physical therapy. So they laid it out all on the line. There was very little research we had to do. Well, I had to do, because my theory was, let's just do whatever. And of course, my wife, she was more behind of the literature of it, just to make sure what they were doing to me was suited me. And then of course we didn't know. We didn't know. So the doctors just are phenomenal. And I'm glad I had the team that I had behind me, because, you hear horror stories, and I'm just glad that the team that I had behind me was complete, thorough. My oncologist is straightforward. He doesn't beat around the bush. He'll tell you like it is, which I love. At first I didn't like it, but after that, I mean, he's straight and to the point. And I just love him for that.
I just want to give each of you a chance to say like a last parting message to our listeners who are patients, who are caregivers. What is the best advice that you can give them around the disease itself, not necessarily bone pain, but the way that you deal with it and the important aspects of, for example, Jamie, you were saying how it's so important to have a really great care team. Mike, do you have any last words to say for our listeners about how to deal with their situation?
I don't know if it's necessarily good advice. What works for me is I don't think about it a lot. I live my life as I would live my life had I not had the disease. And I take it one day at a time. And I'm blessed in the fact that I'm doing as well as I am, that it is in remission. It's been in remission for some time. The damage that's been done, for the most part, is and has been reversible. Thinking about it, worrying about it, it's not going to do me any good. I'm just moving forward at light speed.
Okay, Jamie, any last words?
We often forget about the caregiver because it's always the patient. The caregiver is probably the most important person that you can have on your side. And without a caregiver, doing this by yourself is virtually impossible, or just having someone pick you up, a medical team, medical transportation picking you up. But everybody, and talking to the caregivers, you guys are an important backbone in a cancer patient's recovery. Listen to your patient, or listen to your loved one, or listen to what is going on with their body, and just kind of dwell around that, help them out. That's just the most important thing. And not to think about it, but it's always there. Since I have grandkids now, but it's there. You think about it. I think the motivation is behind, if you do have small ones, or you do want to walk your daughter down the aisle, you think about it. You're like, what if I'm not here to do that? I don't think about it a lot, but there's moments where I'm like, I want to be there for her. I want to be there for him. Now I have little grandkids, I want them to remember who I am, remember Grandpa. But my best advice is the caregiver is number one. The cancer patient is number two. Caregivers, just listen to your patient, listen to your loved one. Do what they want you to do. Don't argue with them, because the steroids is taking them through the roof. The treatments, the dexamethasone, it's putting them in a different state of mind. It's just patience. And my wife had probably the most patience of anybody, because I was a pretty ornery dude. Can't walk again, active guy. So my best advice is just the caregivers to listen to your patient, listen to your loved one or patient, and just take it with a grain of salt and just go with what their needs.
Great. Thank you. And thank you, both of you, Mike and Jamie, for being with us today and telling us a little bit about your patient journey as it relates to bone health. I think that you both imparted some really great pearls of wisdom to our listeners today, and we all really appreciate that from you. Again, our thanks to you from the MMRF, and I wish you both good luck and good health. Thank you.
Thank you for listening to this episode of the Myeloma Matters podcast on bone health in multiple myeloma, hosted by the Multiple Myeloma Research Foundation. The MMRF would like to thank Mike Mankiewicz and Jamie Alamillo for sharing their stories and unique perspectives on bone health. The MMRF also thanks Amgen, GlaxoSmithKline, and Janssen for their generous support of this podcast. If you have additional questions about anything you have heard today, please call the MMRF Patient Navigation Center at 1-888-841-6673 for more information.